Jacob, welcome to the show.
Oh, thank you for inviting me. Really appreciate it.
Now tell me, the month of October is the Breast Cancer Awareness Month, right?
Yes.
What does that do to women emotionally? Do you see a lot of people turning up after that for their mammograms, or does it really build the awareness that it is supposed to? What do you see in the community right after that?
Well, I think that there is a lot of awareness towards breast cancer and mammography, and there's a lot of what we women need to do for each other is we need to take care of each other. We need to make sure that we are looking after our mothers, our sisters, our daughters, and friends, especially our friends. So in my group of friends, we have a little what do you call it? A little game that we play. So whoever is the person who gets their mammogram last has to pay for dinner.
Oh, okay.
So it's kind of a race to get your mammogram done, which I think is good, and it encourages your friends to stay healthy. It encourages your friends to talk about something that isn't necessarily always talked about in the Indian community.
Yeah, right around that time you're reminded that you have to go and get that done. And also, do you see South Asians deferring it more than other?
Because you know, some people are here only 6 months out of the year, so they say, oh well, that's okay, I'll get it in India, and when they're in India they say, oh, I'm going to get it here.
Part of the reason is because we haven't seen our mothers doing that, and that's how we grew up. But now the education is important, and that we should get it done as often as possible.
And sometimes people ask me, well, how long should I get my mammograms for, right? I'm 80. So if you're sufficiently well enough to live another 5 years, then you need to get a mammogram done. If you are sufficiently well enough that you would tolerate treatment and that you would even get treatment, then you keep having your mammograms.
So Dr. Jacob, tell me, what are the early symptoms of breast cancer?
Well, it's important to understand that not all breast cancers are going to be able to be felt, or there may not be symptoms associated with them. And that's why it's very important to do annual mammography, because annual mammography finds breast cancers before they can be felt or any symptoms or signs are identified. The symptoms and signs that you look for would be a lump in the breast, especially a focal lump, pain that can be focal and not associated with the menstrual cycle. Also changes to the skin, such as redness, thickening, dimpling of the skin, nipple changes, nipple discharge. Those are the type of things that you look for.
So it could be one of any of these. It doesn't have to be all of them. So just a lump, which is not even paining, could be a sign?
Definitely, definitely.
How often do you recommend mammograms?
Mammograms for the average risk patient should be performed starting at the age of 40 and done annually. And that's the recommendation by the American Cancer Society, by the American College of Obstetricians and Gynecologists, and also by the American College of Radiology.
Now my question is 40, you say, right? Earlier than that, there is no sign, there is no symptom, there is no high risk, there is no demographics that could be exposed to cancer?
So patients, again, who are at high risk should start surveillance a little bit earlier, and that has to be determined by your physician. And really your risks should be assessed by your physician, and then it should be determined when is the appropriate age to start surveillance.
Now, are South Asians at higher risk?
South Asians are not at higher risk when compared to their Caucasian counterparts, but the research that has been done on South Asian women have been done on women in India and women of Indian origin in the United Kingdom. So there hasn't been a lot of research done on South Asian women in the United States. It is noted, though, that breast cancer is becoming more prevalent in women of South Asian descent in the United States. And the reason is really due to urbanization and industrialization.
How does urbanization and industrialization affect?
That's a good question. There are more professional women, so women actually don't breastfeed as often, or they have children later. They may not have as many children. They may use hormonal therapy, birth control pills, those things. All of those things are factors that can affect breast cancer.
Now, what would be your advice to our viewers, how they should be preventing, and what are some of the areas that we should be watching for?
Certain things that you can do to modify your risk of developing breast cancer is reduce alcohol consumption, maintain a healthy weight, and have a fitness program that's routine.
We talked to Dr. Jacob about the symptoms and the early symptoms and the prevention. Now tell me, if someone has breast cancer, then what?
The first most important thing is just to take a deep breath and to not panic. We have lots and lots of treatments.
It's hard, but practice that.
Yes, absolutely, because it's so important to just take a step back and realize that we have so many treatments and so many novel ways to take care of patients, that the majority of patients, even though they have breast cancer, are treatable.
Okay. Almost all of them are treatable?
Almost all are treatable.
Okay.
So we have surgical options, which include reconstruction, which include cosmetically appropriate surgery. Okay. Then on the radiation side, again in the 50s, we used to give widespread radiation, which gives a lot of collateral damage. So a lot of healthy tissue was being damaged. So we have a new modality, which is called partial breast radiation, and what partial breast radiation is targeted. So it only targets the area of interest. And
so it's not like all over, you can go narrow down to that area.
Exactly that area. And instead of coming for 33 days every day, it's only 5 days. So we've shortened the time, we've decreased the dosages, we've decreased the damage, okay? And so
also decrease the after effects?
Correct. And
like
all the side effects.
Hair and skin and all of that?
Exactly. So it's all trying to get you back to work. It's all trying to get you more of a functional outcome. So going back to my patient, so she came with this lump. We did a lumpectomy. We evaluated her lymph nodes with again limited surgery options, and she had one of those partial breast catheters placed. She had 5 days of radiation. Because we're Indian families, right? So the whole family flew in from everywhere for her surgery, and it turns out that she only needed a day and a half. She was back to going to a temple. She went to the grocery store.
Are you serious? A day and a half?
Day and a half
the
after
time you need for recovery?
Day and a half after surgery, she was
It's
back.
better than plastic surgery, I would say.
Absolutely better than plastic surgery. So a day and a half later, she was back to her things. She's now 2 years out. There's no recurrence. She's doing her regular life and hardly even notices that she had breast cancer. So
now, what about if you develop it in one breast? Are you at higher risk for the other one?
You're at a slightly higher risk. It's about
so regular mammograms right after you detected one is even
correct.
better
And so
choice.
what we do for people who have a mammographic abnormality is we repeat the mammograms every 6 months for 2 years.
Okay.
And then they go on to regular screening if nothing's
What
been
is
found.
the age bracket that you see most women developing the cancer?
So the average age of developing breast cancer is about 64, and it's a bell curve. So people in their 40s can develop breast cancer, but it's a small percentage compared to the rest.
So detection right around the age of 40 is the best thing.
Starting your mammogram at age 40 is really the best thing, because the window between 40 and 50 has the fewest amount of breast cancers detected, but those are the hardest ones to detect because these are perimenopausal women. The breast tissue is a little more dense, and those are the people that are too busy to come and get their mammogram every year.
Right. I've missed a couple of years, but I'm sure I'm going to do this every year now. And
So again, I go back to my original point, which is the earlier you detect it, the less of that you'll need to have. So
right.
It's more of if you do your mammogram and you detect it early, the less of all that other
and
stuff you need.
the success rate would be even
very
higher.
high, very high.
Thank you so much, Dr. Singhal, for joining us.
Oh, thank you.